Today, we're going to talk about a really fascinating medication, one that kind of lives at the intersection of neurology and psychiatry. It's called Lamotrigine. It's an absolute powerhouse of a drug, but as we're about to see, it's one that requires some serious precision.
So you might be wondering, a seizure medication for mood swings? How does a drug designed to stop seizures also end up being a go-to for managing the crushing lows of bipolar disorder? Well, that's the big question we're going to unpack today. Let's dive in.
So here's our game plan. We'll start with what lamotrigine is and how it actually calms the brain circuits. Then we'll look at what it's approved for. After that, we get to the most critical part, the start low, go slow rule, and the very serious rash warning that goes along with it. And finally, we'll wrap it all up with the essentials for using it safely.
All right, so let's start at square one. What exactly is this dual-purpose medication?
Okay, so at its core, lamotrigine is an anticonvulsant. It was actually first created to prevent those electrical storms in the brain that we call seizures. But pretty soon, researchers figured out it also has this amazing stabilizing effect on mood, especially for people with bipolar disorder.
And you can really see its two different jobs here. For epilepsy, its whole mission is to calm down that overactivity in the brain to stop seizures from happening. But for bipolar disorder, it uses that same calming action to help prevent those awful depressive episodes from coming back, making it a super important long-term stabilizer.
So, how in the world does one little molecule do both of these things? Well, it all comes down to how it works inside the brain's incredibly complex electrical and chemical wiring.
Now, to get how lamotrigine works, you first have to understand a neurotransmitter called glutamate. The easiest way to think about it is as the brain's main gas pedal. It's the chemical that tells nerve cells go, 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 fire, send a signal. In the right amount, it's absolutely essential. But too much gas, well, you can imagine the whole system just goes haywire.
So here's the play-by-play of how lamotrigine pumps the brakes. You start with a nerve cell that's just overexcited. It's firing way too much, way too fast. Lamotrigine then comes along and latches onto these tiny little gates on the cell called sodium channels. By blocking them, it basically stops the cell from being able to fire over and over and over again. And the end result? The release of that gas pedal, glutamate, is turned way down, and the whole circuit just calms down.
And this is what makes it so different from a lot of other medications you might have heard of. You know, many common psychiatric meds, like antidepressants, they focus on systems like serotonin or dopamine. Lamotrigine, it takes a totally different road. Its main target is that glutamate gas pedal. It's just a fundamentally different way of trying to bring stability back to the brain.
Okay, so with that mechanism in mind, let's get into the specifics of what this medication is officially approved to treat. On the epilepsy side of things, its approval is actually pretty broad. It's used for focal seizures, which start in one specific part of the brain, and also for generalized seizures, like the tonic-clonic type that most people think of. It's even a key treatment for a really severe and difficult-to-treat form of childhood epilepsy called Lennox-Gastaut syndrome.
But when you look at the world of bipolar disorder, its role is very, very specific and incredibly important. It's not really a go-to for stopping an acute manic episode. No, its superpower is in maintenance therapy. It's used long-term to prevent or delay the return of depressive episodes, which for many, many people is the most difficult and disabling part of the illness.
All right, we have now reached what is, without a doubt, the most critical part of this entire explainer. The success, and more importantly, the safety of using lamotrigine all comes down to one simple but totally non-negotiable rule.
This right here, this isn't just a friendly suggestion, it is the absolute golden rule of lamotrigine. You start with a very small dose, and you increase it very, very slowly over weeks, sometimes even months, and we're about to see exactly why this is so important.
So what does go slow actually look like in practice? Well, as you can see here, someone might start on just 25 milligrams for 2 whole weeks. Then they bump up to 50 for the next 2 weeks. It takes a while to get to that final maintenance dose because the body needs to get used to it very, very gradually. This slow increase is a process called titration.
And here's where it gets even more precise, almost like a balancing act. Other medications can totally change how lamotrigine behaves in your body. For example, if you're taking valproate, also known as Depakote, it actually increases lamotrigine levels. So to be safe, the starting dose has to be literally cut in half. On the flip side, drugs like carbamazepine can lower the level, meaning you might need a higher dose. This is why it is absolutely critical that your doctor knows every single thing you're taking. So you're probably asking, why? Why all this intense focus on slow, careful dosing? Well, it all comes down to a very serious risk that has earned this medication the FDA's most stringent type of warning.
A black box warning. When the FDA puts one of these on a drug's label, it's their most serious alert. It's reserved for medications that have potentially life-threatening side effects. And for Lamotrigine, that warning is all about one thing: a rare but extremely dangerous skin rash. The condition is called Stevens-Johnson syndrome, or SJS. It's a severe allergic reaction. It often starts with flu-like symptoms, but then a painful rash develops that can spread and blister, almost like a burn. It requires immediate hospitalization, and yes, it can be fatal. This right here is why that dosing rule is so incredibly important. So let's be crystal clear. The risk of getting this dangerous rash skyrockets if those dosing rules are broken. Starting at too high a dose, increasing the dose too quickly, or failing to adjust for that interaction with valproate, these are the exact things that dramatically increase the danger.
This means that anyone starting this medication has to be vigilant. You have to be your own advocate. Any new rash, especially in the first few months, needs to be reported to your doctor immediately. And the same goes for any flu-like symptoms that pop up, or any sores, especially if they're in your mouth or around your eyes.
Okay, so let's bring all this together into a clear, straightforward safety plan. Using Lamotrigine effectively is a partnership between you and your doctor, and it really just comes down to a few key principles.
Here are the 4 absolute rules for safety. Number 1, the dosing has to be perfect. Remember, start low, go slow. Number 2, report any new rash to your doctor right away. I don't care how minor it seems. 3, never ever stop or change your dose on your own. Always talk to your doctor first. And 4, your doctor has to know about every single other medication you are taking. No exceptions.
Look, Lamotrigine can be a truly powerful, even life-changing tool for long-term stability, but it is a tool that demands respect and really careful management. Hopefully, knowing all this empowers you to have a much more informed, more confident conversation with your healthcare provider about whether it might be the right strategy for you.